and perhaps witnesses can supplement their answers for the record.
Thank you very much, Senator. I want to go back to a point you made, Dr. Fenton, about understanding the major pathways of human contamination. There are probably plenty of places where PFAS is, and maybe it's the insulation on wires that may have a very low impact on human health, especially if they're hidden behind a wall in an aircraft. But but as I understand it, the main things you're identifying are PFAS that's in our food and in our water. And in the food side, the mention was about biosolids, and what we're talking about is the human waste that's then repurposed as fertilizer. And the fact that so it's interesting that when some PFAS goes through our bodies and doesn't stay in our blood, it finds its way back into our food, and maybe the second time around, it has an impact. But so I really want to focus on those major sources of contamination that affects our health. And you noted one aspect of that. Studies have really focused on holding other factors constant. There's lower birth weight in humans who have a higher exposure to PFAS, and I assume this is by taking blood samples. Yes. So is this hold constant all the other factors, like let's say cigarette smoking is associated with lower birth weight? Is this an area where we really have a pretty clear understanding of an impact?
Yes, sir. Thank you for the question. There are dozens of studies that have shown consistent effects from PFAS-associated decreases in birth weight. And those are epidemiological studies, take into consideration all the things that you were just mentioning: smoking, poor nutrition, socioeconomic status, even the BMI of the mother. They take into those many variables into consideration when they do the analysis in the studies. They're controlled for. So those are things that they control for.
Okay, so we see this in human studies, but then you also mentioned mice studies. And the mice studies, they show the same thing. You mentioned mice that, I think you called them pups. Is that the correct term?
Yes, I probably did, yes.
That, well, we've seen the same effect, so we have both the human studies and the laboratory studies reinforcing each other?
Correct. In fact, the University of California, San Francisco did a systematic review and of all the studies that had shown birth weight outcomes in mouse studies, and at the time, all the studies that had shown birth weight outcomes in human studies, and they reviewed them both all together. So when I say a systematic review, that is all the information that is available in the literature.
So lower birth weight
outcomes
can be an indication of other things, but maybe not the immediate highest concern. But it's an indication something's going on. But you mentioned some very specific things like breast development abnormalities. Yeah. Is that in humans, or is that in mice, or in both?
Well, so I first reported it in mice, and since then there have been 9 studies in women showing that PFAS and PFOA specifically, and a few other, handful of other PFAS, are associated with women not being able to nurse their children. So they have a shorter duration of lactation, is a specific term that they are using in these papers. And this is not just in the U.S. So several of these studies are from other countries. Several are from the U.S. They're showing very consistent, lower.
Okay, I just want to keep this moving. How about other diseases where the studies have shown a significant correlation? For example, you mentioned fatty liver disease?
Yes.
I don't even know what that is, but maybe you're about to tell me. But also, are there other things? Are the show higher cancer rates, for example, for breast cancer or prostate cancer?
Mm-hmm. Yeah, so yes. So some of the things that we have in common are thyroid disease, definitely changes in fatty liver. Fatty liver is when you can tell if a person has fatty liver from their clinical enzymes. Like when you go to the doctor and they say they're going to do a liver panel on you, you can tell if you have some adverse outcomes in your liver based on those clinical, easy to acquire outcomes. Just you do a blood draw, and they can tell you then. But the fat that's accumulating in the liver can lead to non-repairable damage to the liver. And that would be like steatosis, when the liver can become fibrous. Once that happens, it's not reversible, whereas fatty liver is reversible.
So if you were to name like the top 4 health concerns, would they be the ones you've just mentioned, or what would the top 4 health concerns be that there's clear studies associating with higher PFAS?
So birth outcomes, 1. Metabolic
Birth outcomes
disease.
meaning miscarriages, meaning stillborn, meaning, or simply the lower weight of?
Smaller birth weight, and there's really good evidence that links smaller birth weight to long-term adverse health outcomes. And there's thousands of papers that link it to that. So that this is not just a PFAS issue. Anything like poor nutrition, cigarette smoking, anything that causes lower birth weight can lead to adverse outcomes later in life that are long-term.
Okay.
So definitely birth outcomes. The thyroid disease is a big deal. Immune suppression, I would say, is one of the biggest issues. And we do know that PFAS suppresses the ability of the body to properly respond to a vaccination. This is really important in our children. And if children are getting PFAS in their breast milk and from their mom, this really brings home a very important point. We want moms to breastfeed their babies because they provide to the baby immunoglobulins in the milk that help the little infant develop their immune system. But if PFAS are inhibiting that production of a proper immune system, this can lead to long-term immune problems for the person.
Thank you, Senator.
How many different forms of PFAS is there?